Hello, and a very warm welcome from myself, Adela Laverick in Perthshire, Scotland, and my colleague Narinder Dhadwal in London. The aim of today is to share Narinder's incredible story of redeployment from the dental department of the Royal London Hospital to the obstetric and gynecology department, of course, because of the current Covid-19 crisis. Before we share that story, we're going to briefly introduce ourselves and explain our association with the ITI, the International Team for Implantology. Myself, I'm a part-time specialist prosthodontist in a specialist referral practice, and I'm also a mum of a 15-year-old. Narinder, if you'd like to introduce yourself, please.
Thanks. So my name's Narinder. I'm a specialist periodontist. I work in London. I work part-time in private practice, and I also work part-time at the Royal London Hospital, where my role is to teach postgraduate students on the implant clinic.
Thank you, Narinder. Now, both Narinder and I are also part of a newly established ITI committee, the Women's Implant Network, ITI UK and Ireland section, along with our chair, Nicola Cross. We've been tasked with exploring the issue of low female representation within implant dentistry, and we were due to launch at the UK and Ireland ASM, which was due to take place at the end of March. Now, of course, because of the COVID crisis, this had to be cancelled, and we're now due to launch, we hope, in October later this year. Before that, though, we thought this would be a really good opportunity to introduce myself and Narinder to you, and perhaps to the wider implant community, and we can also share Narinder's story with you. So, back to Narinder's story. Narinder, what were your first thoughts when you were asked to be redeployed?
So it was actually a sigh of relief for me, to be fair. I was just recovering from toothache, my first ever toothache. And firstly, it confirmed the saying that toothache is the worst type of pain that anyone can experience. But I genuinely thought childbirth would be, but I was completely wrong, apparently not. So it was a sigh of relief for me. I was on my 12th day of my antibiotics. I was pretty much bedbound. I couldn't do much, and when I got this call, I felt, I just felt really eager to get on with things, basically. So that's how it all began.
And when you were given, I know that you were given some options. What two options were you given about where you might go, and what were your feelings about those options?
So I had a call from my consultant, and he mentioned that there's two options. I can either go into intensive care unit or the maternity wards. So I opted for the maternity wards, and my initial thoughts were, I really want to be in the intensive care unit, purely because I thought there's going to be so much that I can see, do and learn, and I thought it was more relevant to my current line of work as well. So in the end, I decided just to go for maternity wards, thinking that, oh, I'm not going to be of much use there, but I was completely wrong.
Yes, how wrong you were, as we will learn. Could you please give us all a brief insight into your role within the obstetrics and gynecology team? What sort of duties did you have on a day-to-day basis?
So my roles varied depending on what ward I was working on and who I was working with. So on the wards, I was with, say, if I was with midwives, I would help with patient observations, so measuring their blood pressure, oxygen saturation levels, respiratory rate, pulse, and temperature. I was also preparing babies for their phototherapy. We had quite a lot of babies who were jaundiced and required phototherapy, and what that involves is babies normally have to have their eyes covered, and the aim of the treatment is basically to expose as much skin to the halogen light. So I was in charge of putting on their eye mask, which was actually really tricky. And on the wards, mainly just an extra pair of hands, really. Some women, say, following their C-sections, were in such pain that they couldn't move, they couldn't reach out to their babies, and some just wanted a little bit of help just to pass their baby to them. So my role in the theatres was much more involved. I was very closely working with the anaesthetist, where I would help them position the patient prior to epidural administration. I was cleaning and disinfecting the skin, and following the administration of the epidural, I was involved with dressing the patient afterwards. The other thing I did on theatres was I was asked to scrub up and help retract a woman's womb whilst there was an assisted delivery with forceps via C-section. So that was quite involved. I was involved there. Yeah, that was quite interesting. Following the birth of the baby, I would be in charge of giving them their vitamin K injections, which are quite common to help the clotting process, and just generally putting their nappies on, putting their clothes on. So it was all really nice. So I managed to do quite a fair bit.
Out of interest, do you have much previous experience of dealing with babies, or was that aspect of it all very new to you?
Completely new. I mean, don't get me wrong, I absolutely adore babies and I wasn't scared at all, but I had no experience at all.
Right. So a fast learning curve.
Yeah,
very much immersed in sort of the whole breadth and depth of what was going on in that ward. Were you well prepared? What sort of training did you get?
In terms of training, we were given very good training. I think it was just pitched at the right level. Day one consisted of introduction to the staff and just going on to the wards and the head midwife just showing us around. Day two, we had cannulation and venipuncture training, which was a really good refresher for me, because the last time I had been exposed to that was since my undergraduate days. So that was really useful. And sometimes it's just good to know, what equipment they have on the ward, so you know what to expect and where to find things when someone asks you to go and get a certain thing or a certain tube. Then day three was arranged by the maternity ward, the maternity unit themselves. That was quite intense, actually. It was more of a role play type training, where we had 6 stations and all the dentists were divided into groups and we would all rotate around the stations. Let me see if I can remember those 6 bits of training we had. So there was electronic fetal monitoring, which is a device that's used to monitor fetal heart rate. We had pre-eclampsia and eclampsia. We had what would you do in a case of maternal hemorrhage. We had a shoulder dystocia case, where the shoulders of the baby come out first. And we also had a little update on PPE, so donning and doffing. And we were also taught on how to deliver vaginal breech deliveries. So I think it was just at the right sort of level. So we weren't all walking onto the wards feeling like really clueless as to what was going on. We were taught like the terminology and and briefly like what we can expect to see. So I thought it was really, really good.
Good. It sounds like you were very well prepared and that the training, just hit the right level for you. Emotionally, though, how did you feel on that first day?
Emotionally, I was actually really excited. I couldn't wait. I actually couldn't wait to get my hands dirty. I was desperate to get into theatres and just get my hands dirty and just get on with it. That was really nice because the consultants were really welcoming, really appreciative of any help that they could get. So not only the consultants, the whole team, they were so appreciative and just wanting to get us involved. So that was really good. I really enjoyed it.
Good. Well, that's good to hear. I would think that as a dentist, you've got many transferable skills, perhaps some that you just take for granted. But what do you think as a dentist you particularly brought to the team?
So I would say an understanding and caring attitude, a lot of patience, a lot of maturity. I think just getting on with people from different backgrounds, just good observations really, and also, you know, emotional and mental strength, if you like. So, and I think these are all really important on particularly being on the maternity ward.
Yeah, no, I would agree, definitely. I'm sure you really added a lot to the team. It's lovely to hear about it. Out of interest, how much did you feel that the COVID issue was ongoing? Did you feel that you were part of the sort of COVID-19 front line, or did you feel separate from that?
I did. There were a few COVID positive patients on our ward, so I did feel that, you know, I was helping in a time of such, you know, crisis. So you know, and I mean, it wasn't a problem. I was just happy to help where, you know, there's a lot of the doctors or the team on our wards had to obviously go down to the intensive care unit. So that would mean that the maternity wards were slightly short staffed. So any help that the midwives could get, they were so appreciative of, because they were pretty inundated. So it was nice to be able to help.
So you didn't feel too put off by the use of the PPE and the COVID issue?
Not at all. We were given all the PPE that we needed, and you know, everyone was well equipped with it, so it wasn't a problem at all.
Good. Just wondering, what was your most memorable moment looking back on it all?
Oh, there were too many memorable moments. I would say I was basically just being there for a mother whose husband was not able to witness the delivery of their twins via C-section, which was kind of upsetting for me, I felt, because I could see that the mother was quite upset. You know, that the husband had to look after their firstborn, and she was in this sitting on the operating table, really nervous, really scared, just saying how she's alone, and you could just see that she just felt really vulnerable. So just being there for her, reassuring her. Once the delivery took place and they managed to deliver her twins successfully, it was nice to be able to dress the baby, wrap the baby up in a towel, and then bring her daughter to the mother, where she ended up calling her husband from the operating table. So suddenly I was part of a conversation between her and her husband whilst holding her newborn. And
wonderful to share. That must be so emotional. So wonderful.
It really was. I mean, you could see the excitement in his face, and the firstborn, she was about 3, and the father was saying, "Look, that's your new sister or sisters." So it was just nice because I felt really involved. I was like, you know, part of the conversation.
Oh, I bet you did. That's wonderful. Any other moments that spring to mind as being very memorable?
I would say memorable, but more of a sad case where I witnessed a stillborn, which wasn't nice. I wasn't really expecting that at all, because it was actually on my last day on the maternity ward. But yeah, that was something that I don't think I would forget. The other situation was where we had a case of shoulder dystocia. And the midwife had struggled to deliver a baby, so she raised the alarm, and within seconds there was over 20 people in the room trying to deliver this baby, who wasn't quite in the right position, and that was just incredible, because you know, really made me feel that the team really have to be very responsive and act really quick. But thankfully everything was okay. And having a chat with the anaesthetist afterwards, he had just mentioned that in a case like this, when a baby is sort of stuck, if you like, it's really critical, because depending on how long they're stuck for, it can have an effect on you know, on the baby afterwards, you know. So he was expecting, because of lack of oxygen, the baby's IQ would be probably reduced by about 10% or so. So things like that, you know, it just really brought to my attention how important these things are, and you know, and how.
And great to see that the medical team responded so quickly, and it's that you remember, you know, that's one of your memories, the quickness.
For sure, yeah.
That's good. So what just an incredible experience that you had. I think lots of highs and lows and lots of variety during that time as well. What do you think the experience taught you that you might be able to take back to your sort of pre-COVID normal life?
So I would say communication and teamwork, for sure. I think everybody, in order for a team to function adequately, efficiently and effectively, everybody has to contribute their role within the workflow. And that is something that I definitely learned, especially from the last emergency case, where a case of shoulder dystocia, you know, where the midwife struggled to deliver a baby, emergency call was raised and everybody was there within seconds. And it just made the teamwork and the communication so much more apparent in a medical setting than what I'm normally used to in a dental setting. Yeah. We don't really get to see that many, or we don't deal with that many emergencies on a daily basis. So this was really important, and it just highlighted how important teamwork and communication really are in a medical setting. So yeah, that is one thing I will certainly not forget.
Wonderful. Well, thank you so much, Narinder, for sharing that story. I think it's just incredible, and I can see sort of the enthusiasm and the fond memories in your face when you talk about it, which is lovely to see. I also think it's wonderful that you were able to support the National Health Service during this critical time when it clearly really needed help, and you were able to take your skills and your compassion from dentistry into medicine. And I think it was wonderful that you were given that opportunity. So thank you so much for sharing the time with us, and I hope that people have enjoyed listening. Thank you.
Thank you.